COVID has shown us the importance of families, neighbourhoods and communities, all of which are examples of what academics call social infrastructures. When the links between these groups are broken, this increases inequality, but when they are built, they are key to recovering from crises. My ESRC research in West Bengal in India showed how policies could negatively impact social infrastructures. From this, I built an approach to policy based on a social calculus, which looks at how interventions affect networks of care and support among marginalised groups. I then applied this to understanding the UK economy as a co-manager of the ESRC Centre on Rebuilding Macroeconomics based at UCL. When COVID-19 struck, I applied the social calculus approach in a national emergency.
Laura's key contribution was to help SAGE understand and emphasize the important role communities play in forming solutions. The way we could do this was by receiving real-time evidence from Laura's research. This perspective was critical in making sure that the science advice that SAGE provided to government emphasized the importance of tailoring communication and preferences that were appropriate to all citizens and communities. It also helped us increase our understanding of how science, and particularly social science research and methodologies, can help inform public engagement and communications.
We found that while COVID measures damage social infrastructures, the national emergency also inspired communities to help vulnerable members of society. We tracked these links as they were broken and rebuilt. As a result, I advocated for policies to support marginalised households, such as the right to say goodbye to loved ones, social bubbles for extended family networks, community health initiatives, and the prevention of racialised stigma. My proudest and most humbling work was on the community champions. I advised the Ministry of Housing, Community and Local Government, now known as the Department for Levelling Up Housing and Communities, on social infrastructures to address vaccine hesitancy and public health. 60 of the most deprived local authorities were funded to develop community champion schemes. Local and voluntary sector groups mobilised against the odds. They delivered food parcels with public health leaflets inside them, cooperated across communities to provide vaccines in mosques and other places of worship, and gave debt advice or mental health support. Between May and October 2021, because of cooperation across the NHS, local authorities and community champions, the percentage of over 50s who received both doses of the COVID-19 vaccine increased in all ethnic groups, and in some by over 20%.
Since October 2020, Laura has provided crucial advice that has been central to design, implementation and evaluation of the new Deal-Up Community Champions Programme. Community champions, also known as health champions, are community members who volunteer to promote health and well-being or improve conditions in their local community. Champions use their social networks and life experience to address barriers to engagement and improve connections between services and disadvantaged communities. We formulated our approach to the Community Champions initiatives using Laura's research and papers as a basis. She contributed directly to the overall design, call for proposals from local authorities, and training and valuation processes. Her ideas, writings, and assistance have led to the current success of the programme, which is running in 60 local authority areas in the most deprived areas of the UK.
During the COVID-19 pandemic, I provided evidence that meant communities could be better supported in their moments of loss, navigate their caring roles, and work together to overcome public health challenges.